Just move towards the right and notice towards the patient face over the both thyroid gland for any thyroid blueing. Hypothyroidism, the jerk will be slow, that is slower relaxation. In case of thyroid gland examination, we have to remember two things. That one is examination of the thyroid gland, and the second one is the examination of the thyroid function, that is hormonal status. Okay, so some functional features of probable hyper or hypothyroidism, and examination of the gland itself. So examination of the gland will involve that inspection, palpation of the gland, percussion over the sternum for retrosternal extension, and auscultation for thyroid bruit. Whereas the functional status will be checked almost all over the body, because thyroid hormone is a general hormone. It acts all over the body. No cell in the body is out of control of thyroid hormone. Therefore, starting from the hand, the pulse, okay, from the reflexes, face, eye, then legs, and obviously finally the lymph nodes will also be included in within thyroid gland examination to exclude possibilities of thyroid malignancy, lymph metastasis. So to initiate with thyroid gland examination after complete prerequisites, in the hand, we will see some features of either hyper or hypothyroidism, such as there may be palmar erythema in case of hyperthyroidism. So first you have to look for the palm of both hands for palmar erythema, which might be present in hyperthyroidism. Number one. Number two, you have to feel both the hands, because in hypothyroidism the skins may be dry and thick, whereas in hyperthyroidism the skins may be sweaty. After that, you have to check for the tremor in case of hyperthyroidism. We all know that tremor of hyperthyroidism is fine tremor. So you have to ask the patient to spread the arms, and you have to keep a thin piece of paper over the hand and check for any fine tremor if present or not. So firstly for palmar erythema, then condition of the skin, palmar skin, and then for the tremor. Finally, you have to check for radial pulse, because in case of hypothyroidism there may be bradycardia, whereas in hyperthyroidism there may be atrial fibrillation. So it is important to check the rate and particularly rhythm of the pulse. Okay. So after examination of the rate and rhythm of the pulse and all the hand examination, we will move towards the face. In that case, you have to look towards the patient's eye. Okay. So the examination will be now in the patient being in the sitting position. So firstly, we have to look for the thyroid eye signs. First, look from the side and from the above, from the top, for any exophthalmos. For any exophthalmos or proptosis. So from the side and from the, when the patient will be in sitting position, it will be easier for you. From the above or from the top of the head, just look for either whether there is any protrusion of the eyeball beyond the lids. So look for proptosis or exophthalmos, number one. Number two, there may be lid lag. Okay, so to identify the lid lag, just point a finger over above the level of the head or eyeball, then put the finger down slowly and ask the patient to follow the finger. Okay, and you just look or notice towards the patient's eye for any lid lag. In case of lid lag, the lid will not follow the eyeball. Normally, we cannot see the upper sclera in a patient, in a normal patient, but in case of lead lag, we'll be able to see the upper sclera because the lid lags behind the movement of eyeball due to less movement of the eyelid. Okay, so as the patient is normal, there is no lid lag. Both the eyeball and eyelids move simultaneously. But in a patient in hyperthyroidism or Graves' disease, the lid will be lagged much behind so that you can see the upper sclera. Number 3, in case of Graves' disease, there may be painful ophthalmoplegia. Okay, painful ophthalmoplegia, painful eye movement. So we know how to test the eye movement, that is the H test, okay, which is done in case of oculomotor nerve test. So in that case, the patient will be asked to focus on my or your eye, and you have to move the H and ask the patient to follow the eye. And after completion of this H, you have to ask the patient whether he has felt any pain or not in any of his eyes. Okay, so first inspection for proptosis or exophthalmos, second one examination for lid lag, and third one for painful eye movements. These 3 are the eye signs in thyroid disease. So first in the hands, then pulse, then eye. Okay, now number 4, you have to go for lymph node. Okay, so we have already known how to examine the cervical lymph nodes. After cervical lymph node examination, now we'll move to the examination proper of thyroid gland. So what are the steps I have mentioned? Inspection, palpation, percussion, and auscultation. So main 2 steps are basically inspection and palpation, and inspection starts just with looking towards the patient's neck for any abnormal or asymmetrical thyroid enlargement or any diffuse thyroid enlargement, and looking on the both sides, we'll have to confirm for any scar or any asymmetry of the neck swelling. After that, we know that we have to perform 2 special tests for thyroid swelling. One is to confirm thyroid swelling, which is movement with swallowing, and another is to test for thyroglossal cyst that moves with tongue protrusion. So first you have to ask the patient to pull out his tongues. Okay, there is no swelling and that does not obviously protrude with tongue protrusion, move with tongue protrusion. And next is to test movement with swallowing. And for this, you will have to give some instructions to the patient that just take a sip of water into your mouth, hold, and then swallow. Okay, if the patient swallows at once along with taking without any delay, you might not be able to find if there is any swelling or not. Okay, so you have to take some time in between taking into mouth and swallowing. Okay, so the patient has taken a sip of water into his mouth. Then when I asked him to swallow, he has swallowed, and I noticed that movement of thyroid gland along with swallowing of water. Normal thyroid gland moves with swallowing or deglutition, and obviously the thyroid swelling will do the same. So this is the inspection. Now comes the most vital part. This is palpation. And palpation of thyroid gland should be performed from behind. Okay, so you have to tell the examiner, sir, now I want to go to the back of the patient. Okay, so after moving behind, first you have to take notice the temperature. Feel the temperature over both of the lobes simultaneously on both one after one. First right side and then left side. Okay, so after testing the temperature of the thyroid gland, now you have to test the tenderness. So whole of the thyroid gland should be palpated in a symmetrical and disciplined manner, and it should be started from the hyoid bone. Okay, so starting from the hyoid bone, and you have to notice towards the patient's face to identify whether there is any tenderness over thyroid gland or not, which might be present in thyroiditis. So starting from the thyroid bone, come to the Adam's apple, then it is cricoid cartilage, and just below the cricoid cartilage, it is the isthmus of thyroid gland. And from the isthmus of the thyroid gland, just move your hand just to palpate one at a time, not the both thyroid lobes at the same time. Just move towards the right and notice towards the patient face, and just palpate either in clockwise or anti-clockwise manner the whole thyroid lobe, and then on the left lobe for any swelling or any tenderness if present or not. Okay. Then perform the both tests for tongue protrusion and deglutition again, keeping the both hands over thyroid gland. Ask the patient to move his tongue out. Jibhata ber koren. Feel for any movement of the swelling, and again perform this movement. মুখে নিবেন, আমি বললে এটা গিলে ফেলবেন, মুখে নিয়ে রাখেন, এবার গিলে ফেলেন। Okay. So the patient has swallowed, and I confirm, yes, this is a thyroid swelling or thyroid gland. Okay.